pandemic and the social distancing measures implemented by most countries have caused disruption to daily routines. According to UNESCO, as of April 2020, schools were suspended nationwide in 188 countries, which means over 90% of enrolled learners worldwide were out of education. Gradually, students from developed countries and relatively better off socio-economic backgrounds transitioned to an online model of learning, which came with its own set of challenges, but at least enabled them to resume learning and maintain some form of social interaction. However, students from developing countries and challenged socio-economic backgrounds suffered immensely due to lack of access to digital resources. Uncertainty pertaining to examinations only added to their stress and anxiety, especially for students who are in their final year of school, college, or university. This time has been most challenging for students who come from dysfunctional homes or have pre-existing mental health conditions, as it has prohibited such students from seeking much needed support through facilities that are typically present in schools. In India, this situation has stayed unchanged for well over a year, as government schools have only started reopening recently amidst an environment that is uncertain, difficult, and risk-prone. Even then, what I've mentioned earlier is only the tip of the iceberg, as not much is known about the long-term mental health effects of a pandemic like COVID-19 on children and adolescents. To answer some vital questions on this topic and help you students cope up with this challenging time better, today we have with us Ms. Narita Sabharwal, who is an RCI licensed clinical psychologist who practices independently in Mumbai and Delhi and is on the panel of psychologists at some of India's most renowned online healthcare service providers. Welcome, Narita. It is a pleasure to have you with us.
Hi Nikita, thank you so much. It's a pleasure to be here. Thank you, Nikita. Mental health has been in focus since the very start of the pandemic. And as adults, if we felt the way we have during the pandemic, we can only imagine what children and adolescents have gone through.
Absolutely. We've spoken to students across different regions and socioeconomic backgrounds who have said that they've been feeling unusual lately, with prolonged feelings of anger, sadness, frustration,
Lot of anxiety and sadness.
correct.
What
What do you have to say to such students?
Whatever these children have gone through in terms of anxiety, sadness, frustration and anger is a very normal feeling after the kind of year that we've had. Taking into account COVID-19 and the lockdown, it has not been easy to deal with this even as adults. So it's very important to understand that it's imperative to deal with these feelings. It's important to acknowledge these feelings and to understand how you're feeling about this. Talk about these feelings to people, and if you realize that this is something that you're not being able to deal with, it is very important to get professional help.
So how can students introspect and deal with this emotion?
To deal with this emotion, it's very important to have a proper routine. In your routine, it's important to put, the basic powerhouses of our system, the basic powerhouses of our life, which is basically sleep and, exercise, good food. All of these things, even though we don't give them too much importance, are one of the most important things when it comes to mental health. So taking care of your food, the kind of food that we are taking, if it's healthy, taking care of good 7 to 8 hours of sleep, making sure you're getting at least a minimum of 30 minutes of exercising every day, where it can be a run, it can be a walk, it can be cycling. It needn't always be like going to the gym, but it can be something as simple as just walking around the house. That's something that will probably help these children to deal with this much better, to have a routine basically.
And what part of this routine would you give utmost importance to?
I think the most important part in the routine is your sleep, and especially because of the pandemic, everybody has been home, and the one thing that has gotten disrupted the most is sleep. And sleep is very important. Sleep hygiene is very important, because without that, without proper necessary sleep that our body requires, normal functioning is impaired. So sleep hygiene, wherein making sure you're waking up at a particular time every day, making sure that you're going to bed at a particular time every day, making sure that you're not working from your bed, not working from your room, or not studying from your room. You're stepping out of your room, into a different environment or a different part of the house, which, because our brain usually connects our bedroom to sleep, and if we are constantly in our room, then our mind starts to connect our bedroom with other things. So it's important that sleep hygiene is maintained, wherein we are getting immense amount of sleep, proper amount of sleep in a good way, and at the same time, when it's time to be productive, we are out of our rooms into a different environment, into a different part of the house, where our productivity goes up and our brain doesn't connect the bed or the bedroom to sleep.
Right. And what else would you recommend to children and adolescents?
Another thing that I would like to recommend to them is practicing mindfulness, practicing taking care of their own mental health by being more aware of their surroundings, being more aware of themselves, understanding what is going inside their bodies, understanding what is going inside their minds, acknowledging their feelings, trying to understand better as to how to deal with different things, different situations, different people in different manner. Mindfulness is one thing that is very important. Mindfulness activities help students, help children, help actually anybody become more aware, become calmer in their day-to-day life. This is something that everybody, be it children, be it adolescents, be it adults, everybody should practice this. It is very helpful.
But the steps you mentioned require focus and dedication, which may be difficult for a lot of students and adults in such situations. What does one do?
See, focusing is very relative. It can get very difficult for people, especially in a time where you're sitting at home, there's a pandemic going on, there's so much going on. Every day can feel very unmotivated, demotivated. Every day can feel that not much is happening, not much is being achieved. In a situation like this, it's very important to make a 2-day routine. This is an important rule even for children who are trying to study for examinations, children who are trying to keep up to a routine. A 2-day routine rule is something that's very important, because when you keep a 2-day routine, even if you're not able to finish this in a day or two, you still have the third day to finish it, but you still tick off things from your list, and it makes you feel much more confident. But in a 1-week routine or a month routine, when you're not able to finish up on things, towards the end, just a lot piles up, and that's something that makes you feel demotivated. So that 2-day routine is something that can keep you, or that can help you keep motivated.
Makes sense. So since the COVID-19 pandemic struck, each one of us has had at least one friend or family member who hasn't been in the shape, mentally speaking. As adults, we may be in a position to help others. However, how can children help those around them?
Absolutely. So similarly, like adults, children will also have phases. Children will also be in a point in time in their lives where some are doing better than the others mentally, especially during the pandemic. So when you feel that you're doing well, when you feel your glass is half full and somebody else's glass is half empty, then it's better for you to pour into that person's glass to help them out. This in turn also helps you feel much better. This in turn, helping somebody out, helping somebody feel better always gives us a good feeling. So that's in turn helping us also feel better. So when you're in a shape or a position where you're feeling positive, it's important to give out that positive energy to people around you. It's important to help people understand, ask more questions, feel that they need help. So ask them what they are feeling, how you can help them. And maybe even if it's just a conversation, it can be very, very helpful for your peer to feel better.
Okay, so let's assume a student has done all of the above and felt better. In today's day and age, where there's so much information and misinformation being spread digitally, how does one maintain their mental health?
Okay, so limit your media consumption. That is a golden rule. That is a mantra for dealing with this pandemic. For adults, for children, for adolescents, because there is a lot of information out there. And since we are going through COVID-19 as a pandemic for the first time, a lot of information is true, a lot of information is false. It shouldn't happen that you're taking in all this information, whether true or false, and making it a part of your life, and then that is getting you down. that is something that you yourself have to restrict, from your life. You have to make sure that that is not something you allow to seep into you. If you want proper information, if you want real information, if you want information that can keep you up to date, go to certified sites like the WHO site, which has information that is verified. Unverified information is always going to make you feel in a certain manner that's not going to be good for your health, especially when we are all at home, nobody's stepping out, nobody's interacting with anybody on a personal level. That can be difficult or dangerous. So let's try to limit the amount of information we are taking in, and so that's something we can do.
Anything else you would like to add to this?
It's important to reach out if you don't feel well, if you don't feel that you're doing okay, if you feel that it's okay, I've had a day which is kind of off, or I've had a second day which was off, but now you've been feeling that for a couple of days. Talk to people. Start with your friends, start with your parents. Try to tell them how you're feeling. Express yourself. Even if talking to people, for a lot of people, talking to people is doesn't come naturally. It's difficult. Write down your feelings. And then you start to understand that you're not in the best of spaces in your mind. That's when you reach out to professional help, and it will always help. It is as good as going to a doctor when you fracture your hand. This is just like a minor hurt on your mental health. Come to a professional. It will always help you out.
Thank you so much for your valuable time and feedback, Mrs. Sabharwal. This session has been tremendously insightful. In the next episode, we look forward to discussing with you the effects of COVID-19 on the mental health of teachers and how they can cope up with them. Thank you.